Hi, Dr. Cycle and Professor Handy. My name is Lucy Kellogg, and this is my husband, Greg Kellogg, who volunteered to be my patient today. At this point, I've already taken his case history, gotten his pediatric feeding background, family history, and all that. And as I was obtaining his case history, I had been observing his facial tone, his facial symmetry, how he's been breathing, whether he's a nose breather or mouth breather, and it looks like he's a nose breather. And been checking to see his tongue, rest posture, and lip movement as he does dry swallowing, as we were talking, and so far it looks good. And I'll go ahead and start by giving you an oral peripheral exam. Okay, you ready? Okay. I'd like to check your teeth, first of all, Greg, if you don't mind just tapping your teeth twice. And go ahead and hold it, and I will just check to see your teeth. And your lower first molar looks like it's a half a tooth ahead on that side, and your lower molar on this side, first molar, is also half a tooth ahead of the first molar on your mandible. I'm sorry, on your maxillary. And it is considered to be normal, which is class 1 malocclusion, and that's good. Next thing I do is I will be checking your nares. I'd like for you to tilt your head back. You don't have to open your mouth. And I don't see any evidence of a deviated septum. Your nasal passages look good. And I didn't hear any extra nasal noise to indicate that there's a nasal blockage, so that's good. This time I'd like to take a look at your lips just at rest. Just keep it closed at rest. And I see that they contact all the way through the length, and that's good. You do so without any effort. We just moved to Colorado, and coming from Washington, we've noticed that our skin's drier and our lips are chapped, but I'm looking at your lips right now and I don't see any evidence of lip chapping. You must be using that chapstick. Okay, it looks good. And I can see that your lips have a good tone. Okay, now please, I'd like for you to open your mouth. I'm going to be checking your hard palate. Okay. And I do not see a vaulted palate, which is good. Next thing I want to do is I'm going to be checking your soft palate. So what I want you to do is please say ah.
Ah.
And I could see that your velum elevated when you said ah, which is good. And I didn't see any bluish color lining on your velum, which indicates that you don't have submucosal cleft, and that's a good thing. Okay, and I also saw that the length of your soft palate was fine. Now I want to go ahead and check your tongue, and please open. Can you kindly open your mouth? And from what I see, it doesn't look too big nor too small, which shows that you don't have, doesn't look like you've got microglossia and macroglossia, and that also is a good thing. Can you please stick your tongue out, please? Okay, and if also, it looks fine. Normally, if it's heart-shaped when you stick it out, it shows that you've got a short frenulum, and what would happen would be your tongue would be heart-shaped, which would show that you've got ankyloglossia or tongue tie, and you don't have that problem. Okay, now go ahead and close your mouth and clench your teeth and smile. And I can see that your tongue appears to contact your upper dentition at rest, which is a good thing. And next thing I'll be checking your respiration. Okay. Like I said, it didn't seem like you're a mouth breather. You've been breathing to your nose this entire time, so you're a nose breather. And next thing I want to do is I'm going to have you count from 1 to 30, one number per second, or nearly, approximately one number per second, but all done in one breath. So when you're ready, count from 1 to 30.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Good job. That's really good. Shows that you've got adequate respiratory support. And I also didn't hear any respiratory noise, which shows that you have no apparent nasal resistance, and that's a good thing. Okay, are you ready for my next step? Okay, hold on one second. Let me just go ahead and get things ready.